BP Wash Cleanser is a product that is commonly used to treat mild to moderate acne and a certain skin condition called rosacea. It works by reducing the amount of acne-causing bacteria and causing the skin to dry and peel. For those with rosacea, it may also help to decrease symptoms such as pimples and bumps on the face. It is important to check the ingredients on the label, as the manufacturer may have changed them, and products with similar names may contain different ingredients meant for different purposes. Before using BP Wash Cleanser for the first time, it's important to check if you are allergic to it. To do this, apply a small amount to a small area of acne for 3 days. If you have an allergic reaction, stop using the product and seek medical help immediately. If there is no reaction, then you can continue using the cleanser. There are different types of benzoyl peroxide products available, some of which require a prescription, while others can be purchased over the counter. It's important to consult your doctor or pharmacist to determine the best product for you. If you are using the cleanser, wet the affected area and gently rub the cleanser into the skin for 10 to 20 seconds. Work it into a lather and rinse thoroughly, then pat dry. If the skin becomes too dry, you may need to rinse the cleanser off sooner or use it less often. If you are using the liquid wash, cleansing pad, or cleanser bar, use it instead of soap once or twice a day. Wet the skin before applying, gently work up a lather for 10 to 20 seconds, and rinse thoroughly. Do not scrub the skin. If using a cream, foam, lotion, or gel, apply it to the affected area as directed, usually once or twice a day. Before applying each dose, gently wash the affected area with a mild cleanser, then pat dry. Apply a small amount of medicine to the affected area and rub in gently. Some products may require rinsing off after application for a certain amount of time. Check your product package to see if your form of this medication needs to be rinsed off. If you are using the medicated pads or sponges, wash the affected skin with a mild cleanser, then pat dry. Wipe the pad or sponge gently onto the skin to apply the medication, usually once or twice a day to the skin as directed. The dosage and timing of application will depend on your medical condition and response to therapy. Improvement in acne or rosacea is usually seen after 3 to 4 weeks of use, and maximum benefit after 8 to 12 weeks of use. Do not increase your dose or use this drug more often or for longer than directed. If your condition lasts or gets worse, or if you think you may have a serious medical problem, get medical help right away. If you experience skin reactions such as peeling, itching, irritation, or reddened skin when you start using BP Wash Cleanser, you should tell your doctor or pharmacist. They may advise you to use smaller amounts of the cleanser or use it less often. Your doctor has determined that the benefits of using this medication outweigh the potential side effects. Most people who use BP Wash Cleanser do not experience serious side effects. While very rare, a severe allergic reaction to this medication may occur. Seek medical help immediately if you notice symptoms such as a rash, itching or swelling of the face, tongue, or throat, severe dizziness, or trouble breathing. This is not a complete list of potential side effects. If you notice any other effects, be sure to contact your doctor or pharmacist. In the U.S., you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using BP Wash Cleanser, make sure to inform your doctor or pharmacist about any allergies you may have. This product may contain inactive ingredients that could cause allergic reactions. Also, let your doctor or pharmacist know about your medical history before using this medication. If you are planning to have surgery, inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. It's important to note that this medication may make you more sensitive to the sun. It's best to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and wear protective clothing when outdoors. If you experience sunburn or skin blisters/redness, inform your doctor right away. If you are pregnant, only use this medication when clearly needed and discuss the risks and benefits with your doctor. It's also unclear whether this drug passes into breast milk, so consult your doctor before breastfeeding while using BP Wash Cleanser. When using BP Wash Cleanser, it's important to be aware of any potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with BP Wash Cleanser is dapsone, which is used on the skin. Be sure to discuss any concerns about drug interactions with your healthcare provider. If this medication is accidentally ingested, it can be harmful. In case of an overdose, resulting in severe symptoms like loss of consciousness or difficulty breathing, it is important to seek immediate medical attention by calling 911 or contacting a poison control center. In the U.S., the local poison control center can be reached at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Make sure to keep up with your regular appointments with your healthcare provider and any necessary lab appointments. This will help to ensure that you are using the BP Wash Cleanser effectively and that it is providing the intended benefits for your skin. If you are using this BP Wash Cleanser on a regular basis and happen to forget a dose, just use it as soon as you remember. However, if it's almost time for your next dose, then it's better to just skip the missed dose and continue with your regular schedule. It's important not to double the dose to make up for the missed one. Just stick to your regular dosage and timing for the best results. When it comes to storing BP Wash Cleanser, it's important to keep it at room temperature. Different brands may have different storage requirements, so it's best to check the product package or ask your pharmacist for specific instructions. It's also crucial to keep all medications out of reach from children and pets. When it comes to disposing of BP Wash Cleanser, it's important not to flush it down the toilet or pour it into a drain unless instructed to do so. It's best to properly discard the product when it's expired or no longer needed. If you're unsure about how to dispose of it, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.